Well, good afternoon, and thank you for joining us today for this webinar entitled Effectiveness of Public Health Mutual Aid Through Mission-Ready Packages. My name is Angela Koppel. I'm the EMAC Program Director at the National Emergency Management Association, and I will serve as your facilitator. We have two excellent presenters today. Victoria Carpenter is the chair of the EMAC Executive Task Force. She serves as the EMAC coordinator with the Louisiana Governor's Office of Homeland Security and Emergency Management. Victoria is the most frequently deployed A-team personnel in EMAC's history, and she is considered the national expert on EMAC and EMAC reimbursement. Victoria is going to provide an overview of EMAC for us. She'll be joined by Gerrit Bakker, the Senior Director of Public Health Preparedness at the Association of State and Territorial Health Officials. Gerrit's going to talk about the development of mission-ready packages and templates for mission-ready packages for medical and public health resources. This is a project we've been working on for the last year and a half, and I'm excited to hear Gerrit's update. Victoria, I'm going to turn it over to you.
Thank you, Angela. Good afternoon, everyone, and I'm honored to be a part of this webinar today. We're going to get started, and we're going to talk about what is EMAC. EMAC is a nationally adopted mutual aid agreement that establishes a national system to facilitate the sharing of state and local government publicly owned resources across state lines during times of emergency or disaster, as long as there is a state of emergency declared by the governor of the affected EMAC member state. What type of resources can be shared under EMAC? Listed here are some resources that were shared under EMAC in response to Hurricane Sandy. As a note, any resource or capability that one state wants to share with another can be shared under EMAC. This includes commodity and just the sharing of resources. Two examples of some not so very common missions that we've done in the past was newborn blood screening for generic anomalies. Blood was sent from one state to another to test for treatable newborn genetic factors. The blood was shipped and results were sent back to the hospitals. Another one was the transfer of 911 calls from one state to another to handle an influx of calls during an emergency. How can you utilize EMAC? Basically, any resource or capability can be deployed. Bottom line is, if you need it, ask. Chances are another state's going to have that resource that you need. Why EMAC? There are legal protections under EMAC. There are 13 Articles of Agreement in the EMAC law. We aren't going to look at all the articles, or we're not going to go through and spend a lot of time with them today, but it's important to understand what these provisions do so you can better understand how the compact works. There are big 5 things that the law does. First is EMAC is managed by the state emergency management agencies on behalf of their governors. The articles provide for tort liability protection, transfer of licensing, certificates, and permits. It addresses workers' compensation and reimbursement. For a full text of the EMAC Articles of Agreement, see the EMAC website at www.emacweb.org. EMAC has been signed into law by all 50 states, the District of Columbia, the Commonwealth of Puerto Rico, the U.S. Virgin Islands, and Guam. There are 5 phases of the EMAC process. The 5 phases include pre-event preparation, activation, request and offer, mobilization, response, and demobilization, and reimbursement. In my presentation today, we're going to review the first phase, pre-event preparation. This is where you do everything that needs to be done prior to leaving on a mission. On the state level, what are some of the things that should be happening? Should be the plans and procedure for implementation of EMAC, including the reimbursements. These all should be established prior to an event. You should include EMAC in training and exercises. Mission-ready packaging is a part of this first phase. Mission-ready packages, better known as MRPs, are specific response and recovery capabilities which are organized, developed, trained, and exercised prior to an emergency or disaster. MRPs are based on the next logical step after NIMS resource typing. The NIMS resource typed equipment are part of the mission-ready packages. Take note, though, that even if you do not have to be NIMS resource type to develop a mission-ready package. MRPs are developed by the resource owners and providers and are coordinated with the state emergency management agencies. Reducing the time from request to mission deployment means knowing what you have and the cost associated with that resource. To give you an example of what information is needed to put together an MRP, I will review an epidemiology strike team package with you. During the recent HIV public health event in Indiana, several disease intervention specialists were requested and deployed to assist through EMAC. So let's look at building a mission-ready package for this type of team. First, we need to look at what is needed to do this mission. First, you'll have to come up with, of course, a mission description. You want it to be somewhat descriptive. You want it to include the number of personnel, equipment, what functions they'll perform, and so on. I'm going to go over and just read to you a description of an epidemiology strike team, just so you can get an idea of what the mission description should have in it. The epidemiology, surveillance, and investigation strike team identifies, monitors, and investigates disease outbreaks or other conditions of public health importance during a disaster. The team performs the following functions. It manages and provides epidemiological surveillance and investigation, manages, implements, and monitors order control measures, including isolation and quarantine. Augments in place epidemiological functions. Team to work 12-hour shifts and must be self-sufficient for the duration of the mission. Total personnel is 5. To assist you with putting together mission descriptions when you're building your packages, FEMA Resource Typing Tool, or TLT, RELT, is part of the online Mission Ready Package building system. This tool allows you to search for public health and other type of resources and view all of the resources that have already been NIMS typed. You can find this link by searching the FEMA website under Resource Typing Library Tool. The MRP template is basically an Excel spreadsheet. It has tabs for equipment, personnel, commodities, food, travel, and other costs. And all this type of information and costs needs to be captured in your packages. All of the components have costs which, like I said, need to be captured, and many of these are relatively easy. You can estimate your estimated personnel rates or equipment rates, so on. Once you have your package built and you know where you're going, it's easy to go in and plug in the travel costs. You can also pre-estimate your travel costs by using your state per diem rates and estimate them for a 14-day mission. And then you can always go in there. The templates are real easy to amend, and they do all the calculating for you. What to learn? If you want to learn more about Mission Ready Package or developing on your own, it's easy to do. You go to the Mutual Aid Resource tab on the EMAC website, scroll down to Mission Ready Packages. See on the right side of the page, you will see a link to all the specific disciplines. If you go to those tabs, you'll be able to see models for packages. The models identify the types of things you need to think about, again, such as equipment, commodities, personnel, and this will help you to develop your own response-specific mission-ready package. Medical and public health mission-ready package templates are now available. To access them, click Medical and Public Health under Deployable Resources on the right side of the screen. Then click Medical and Public Health Models. Our next presenter, Gerrit Bakker, and his team created the templates and the MRP companion document available on this page. Before we turn it over to Gerrit, let's take a quick look at the mutual aid support system. After your Mission Ready package is developed, you can log into the EMAC website and access the mutual aid support system, MAS. Here we see several MRPs on the map view of the MAS. What is MAS? The mutual aid support system focuses on mission-ready packaging. MAS can talk to your existing resource management systems. MAS pulls your current resource inventory and adds the mission-ready packaging fields. You can export a spreadsheet from MAS that you can upload directly into an offer section into our EMAC operating system. You control the data view, and you can see or who sees your resource inventory. For additional information on MRPs and MAS, you can also view the Training and Education tab on the EMAC website. This concludes my section of the webinar today, so next we'll turn it over to Gerrit Bakker. Thank you.
Thank you, Victoria, and thank you to NEMA for inviting ASTRA to participate in this webinar. It's been our great fortune to be able to be a partner of NEMA for some time, and the outcome of the packages that I'm going to present to you today is one of the results of that partnership. So let's do an overview of mission-ready packaging, just to add a little bit more to the discussion that Victoria has already presented. Mission-ready packages are the way to offer assistance. It's the basis of the offer of assistance. It's a way to streamline and facilitate the process at a time when it's often difficult to be able to specify all of the needs that you have in mind. It's also a way of defining clearly what you want. Public health has struggled with this area. So what we've attempted to do is make sure that the mission-ready packages are capability-based. In other words, you have someone who can accomplish a particular task, regardless of how they acquired the skills that enable them to do that. A simple example is the fact that public health has sometimes had difficulties even defining what an epidemiologist is. In one jurisdiction, an epidemiologist might simply be someone who has done disease investigations, whether it's of a sexually transmitted disease or a foodborne, and knows how to fill out a questionnaire and plot an epidemiologic curve. In another jurisdiction, an epidemiologist might be someone who has an advanced degree in epidemiology from a school of public health. For the purposes of mission-ready packaging, it's unimportant how they acquired the skills. We just want to make sure that they have the skills necessary to perform the task, and that when you make a request for a particular capability, you will have the capability that you requested. So moving on to EMAC's future, the mutual aid support system is the key, as Victoria described. And I only bring it up here again because in addition to the mission-ready packages that ASTO has developed that we're going to explain here in a moment, many states and many regions had already done a lot of this work, particularly regions 4 and 6 in the Gulf Coast area that have a lot of experience in responding to emergencies, had already developed a lot of these mission-ready packages, and so it wasn't necessary for us to try and recreate them. But what MASS will allow for all of us to benefit from is a single place to catalog and inventory all of the packages, whether they've been developed by us or by anyone else. So moving on to the ASTO-NEMA partnership, I mentioned that we've worked with NEMA for a long time, and we're very grateful to them for their generous support and the way that they have funded and made this work possible. One of the things that we all recognized together was that, as I mentioned earlier, public health has lagged behind the other disciplines in this area. While there were some regional and state-based mission-ready packaging, it had never been done successfully on a larger scale. Public health and emergency management have strengthened their partnerships in the last few years. Emergency managers are now more aware of the role of public health, and public health officials are more aware of the processes and procedures established by emergency management, the multiple sectors they manage, and their key role in coordinating a response. ASTO and NEMA are long-term partners on multiple projects. We help train each other's new members. We have a joint policy work group. We take positions on issues that are important to both of our disciplines. And so to take this next step and develop mission-ready packaging was a natural for these two organizations. The next slide, we talk a little bit about our partnership. So ASTO and NEMA have partnered on this project to develop both public health and medical-focused mission-ready packages, and that's a distinction I'll make in just a minute. The mission-ready packages are developed with the support of an advisory group of public health, medical, and emergency management professionals. So on the screen you see where those our advisory team come from. So you see of most importance, besides somewhat geographic diversity, is the fact that we have state and local people, those from associations. We have some federal partners who are participating in the process as well. In the first year of our grant, we developed the phase 1 of mission-ready packaging. These packages were very specialized and tended to be more healthcare related. This was done for a few reasons. In most of these cases, the mission-ready packages in Phase 1 were a direct outgrowth of a need that someone had experienced in the field. Also, by being more specific about the type of package that was developed, it really enabled us to get our feet wet and to understand the process and to develop some clearly specified packages in the year 1. So there were 10 mission-ready packages in year 1. They fell under these 4 categories: fatality management, mobile field medical care, shelter and functional needs, and medical surge. So digging a little deeper into the Phase 1 mission-ready packages, the first one you see is the bariatric ambulance team. Bariatric ambulance team provides life support care in response to bariatric patients through the use of specialized bariatric vehicles. So again, a very specialized type of specialized team. In similar ways, you have the four-wheel drive ambulance team providing you see the use of common language, life support care in response to patients through the use of a specialized four-wheel drive ambulance team. So these are teams that are augmenting existing EMS and providing them with support and in some cases on-scene medical care. The next Phase 1 teams were patient transport. Patient transport team is providing life support response and supplements the ground ambulances and EMS personnel. This is in areas where there may be limited amount of ambulances and EMS vehicles for the size and scope of a mass casualty event. The next one was a pre-hospital acute care team, again providing a support role to existing EMS services. We have the clinical care team. These may are a little bit different, and the clinical care team provides supervision services to those providing support who may have a little bit less experience. You see the types of services that they are ensuring, and ensuring is always a key public health function. The next one is the disaster portable morgue unit. That one pretty well explains itself. Similarly, the next one on the next slide is the morgue processing team and the morgue triage team. So dealing with mass fatality events and augmenting coroner and medical examiners. This was an important one because we know that those roles, the coroner and the medical examiner, can differ widely jurisdiction to jurisdiction and state to state. The last group from the Phase 1 mission-ready packages is the medical facility and emergency water supply team. Again, a very specialized need, but certainly a very important one. And the last one was the behavioral health team. This is a rapidly expanding area in public health, and one that has been a really crucial function in some of the disasters that have occurred recently, particularly with active shooters. So those were the 10 teams developed in Phase 1. Victoria mentioned earlier that there's a companion document available on the EMAC website. This slide describes a little bit about what you can find in the companion document. That is available on the website, and you get a picture there of what it looks like. So based on the Phase 1 development, success we had there, the acceptance of the packages that were developed, NEMA very generously supported us into a Phase 2 and in a year 2 of mission-ready package development. These mission-ready packages are more oriented towards at least what I consider to be a more traditional public health activity and response. And as was described earlier, the Indiana HIV outbreak has shown and demonstrated the need for this type of support. And I think that response was a very critical one, an important one, because I believe that in previous years a health department needing additional support to conduct an outbreak investigation may not have gone through the EMAC process. And I think the work of our organizations and the nature of the responses in the past few years has really elevated the awareness of EMAC such that it was just a natural for the Indiana Health Department to request assistance through the EMAC process. So in phase 2, you see, as I mentioned, the more traditional public health areas, epidemiology and surveillance, radiological monitoring. That was an important one because there doesn't tend to be a lot of expertise, or at least a widely dispersed amount of expertise in that area. Foodborne illnesses, when an outbreak of foodborne illness is underway, you never have enough people to help conduct the investigation. Public health and medical operations support is pretty self-explanatory, and then the medical support for shelter operations I'll describe a little more later. So let's start with these phase 2 mission-ready packages, beginning with the epidemiology surveillance team. That was really summarized very clearly in the earlier part of the presentation. This is just the description for the team that we developed, but there's going to be a lot of similarities to the one described previously. The next one is foodborne disease epidemiology support team. So there's a specific skill, a particular capability, often a specific software type of expertise that might be related to a foodborne illness, and so this team categorizes all of that. The next mission-ready package is public health and medical operations support. This is just help. A lot of times, given the current state of public health funding, there's a lot of jobs, a lot of resources that have been lost, and you just need a deeper bench to be able to sustain a response for a long period of time, or to run multiple shifts of a response without burning out your staff too much. So this is a generalized support and assistance team. The next one is the radiological monitoring and decontamination teams. Very specialized skills, very specialized type of response, but one that we recognized was, and the work group recognized was a key capability that needed to be developed. And then the last one has undergone a lot of changes. This is on medical support for sheltering. So there are requirements within the law for special medical and functional needs sheltering. So this team could theoretically assist in the development of a functional needs shelter. It doesn't have the behavioral health team component that we described in phase 1, so that would be a separate request. But the other way that we envisioned a team of this sort might be used is if you've got something unique. If for example, you're evacuating a nursing home that's in the path of a wildfire, you would have specific requirements and specific needs for a geriatric medical support. This would be the way that you might be able to request that type of assistance. So while we're still pretty new into all this, here's some feedback that we're requesting of the field, and that includes those of you who joined us today. So we would like to know more about what potential uses you might see for the mission-ready packages that you saw presented today. And certainly we want your comments and inputs, particularly on that phase 2 group, which we're finalizing during this phase of our work. And then suggestions for future MRPs that would have assistance for emergency managers that have a public health and medical focus. In other words, we're trying to identify the gaps. So the next steps for us is we'd like to see them used. They're on the MASS system. We'd like to learn a little bit more about if they're valuable, if anybody's used them, if they had some successes, some challenges while they were using them. the URL listed there shows you where you can get them, and then some of the potential uses. We're also hoping to continue to catalog previously developed mission-ready packages into the MASS system. We're socializing this concept to our public health brethren that are less familiar with the concept, presented at a number of conferences, and want to continue to socialize this, and are always welcoming to anyone who can help us get the word out about how to use these things, and that's why we're grateful to be able to join you today. The next steps continued would be to upload the packages into MASS. If you want to learn more about it, EMAC and NEMA have a lot of great resources available to you, so that's where you can access them. And then lastly is my contact information, and my colleague Lisa Peterson at ASTO, who's been instrumental in helping us develop this work, and the project manager from Tetra Tech, Giselle Perry, who has been a great assistance leading the work group. So with that, I'll conclude my presentation, and thank you for your attention, and I think we go back to Angela at this point.
Well, great. Thank you, Gerrit and Victoria. I'm going to turn us over to questions now, and if you do have a question, please type it into the questions pane for either Gerrit or Victoria to answer. Our first question has a lot of acronyms in it, so here we go. Every state has identified huge shortfalls in manning for S&S MCM scenarios. This type of event is probably the single biggest one where we can clearly know jurisdictions will need more trained people rapidly. Has any work been done to get every state likewise to develop S&S MCM mission-ready packages to help out other states with pod, warehouse, or command and control teams for this type of event?
Yeah, I'll take that one, and it's a great question. And just to define the acronyms used there, we're talking about mass dispensing of resources from the strategic national stockpile through points of distribution. This is an area that the questioner is certainly correct that everyone is responsible for that capability. It's one that presents unique challenges, and I would say that while no, there's nothing been done on a national level to this point, part of the reason for that is the changes that CDC has made in their requirements for the operational readiness review. And I think now as they get more comfortable and use that tool more widely and learn about the readiness capabilities of each of the jurisdictions, I think it presents the opportunity for us to take that on in the future. And we'll certainly look at that as a next step.
All right, the next question. Will there be additional phases, or does the 2 phases of this project pretty much cover all potential emergencies or disasters?
Well, it doesn't cover all of them, as we just learned. There's still other places that we could go. As to what our future work is, it's like everything else. It's funding dependent, but we would certainly like to continue this work.
All right, next question. How are the contents of the various missionary packages determined?
I'll let Victoria talk about that from a more general perspective, and if there's anything I can add public health specific, I'll do that.
Well, I guess basically you need to identify what resources you have to determine, what packages you can build initially. I know we reached out to our fire folks here in Louisiana, and we started building the mission-ready packages and started working on search and rescue type teams. So you really need to look at your state and your county or wherever you're from and your parishes and just see what resources are there, work with those agencies and start putting your heads together and building a package. Like we said earlier, your resources do not have to be NIMS resource typed. So if you have an asset that you feel would be beneficial to another state, then work with your state EMA and develop packages.
And I'll add on to that, one of the missionary packages that Victoria first developed was she actually took a team that had a deployment And when they got home, she sat down with them as they were developing their reimbursement package and worked with them to develop their mission ready package for their next deployment, which I thought was quite smart, because you have all the costs, you have, all the elements that went into that mission right there in front of you. Our next question: the radiological monitoring and decon group are they made up of public health personnel?
Primarily, but not exclusively. Radiation expertise is an interesting one, because that tends to fall in different departments in different states. If you have a joint health and environmental health agency, they might be in the same department. If there's a different type of structure for the setup of your departments in your state, it could be different. So, we're a public health association. We tend to take that focus first, but it's not exclusive, and it certainly wouldn't have to be.
I think this next question is for me. Can anyone access the mutual aid support system website, or do we have to request access? If we do have to request access, what is that process? So mutual aid support system is accessible through the EMAC website, which is at www.emacweb.org. And you can actually go to that website and set up your own username and password. So just register for a username and password, fill it out, and once you log into the site, you'll be able to see the link to the mutual aid support system, or MAS as we call it, and enter your mission ready package there. And I do not have any more questions, so that was the last one. All right, well, if you'd like to continue your EMAC learning, we have a number of opportunities for you. The first one is the E0431 course entitled Understanding EMAC, which is taught at the Emergency Management Institute at FEMA's EMI. We also have 5 online courses that are open to the public. Again, if you go to the EMAC website, register for an account, you can go into the EMAC e-learning center and take one of these courses. I'll draw your attention to the course entitled Pre-Event Preparation for Resource Providers. It focuses solely on activities that you should complete before a disaster, such as developing your mission ready packages. I'm going to sign off by thanking you in advance for completing the evaluation that will come up. And thank you for your participation on the webinar.